For those who are coming to the hospital, we are taking care of them.
Okay.
But we need more. Now the hospital, we are not supposed to treat a positive case who needs admission.
Okay.
But those that we suspect the other things, we have the equipment that we are using. But we need more. If anybody will want to help us, the person is welcome.
Okay, so what are the challenges the hospital is facing in terms of this COVID-19 area?
The challenge is that now we are spending a lot of money to buy some of these PPEs, to buy what we call medical consumables, things that we use to clean the hospital. We spray the hospital very often, so we need a lot of money and medical items. Those are our challenges. The second challenge, that one is not the hospital, but I know that if the community is not doing it, it's the hospital that will suffer. That people are not obeying the simple hand washing, social distancing, and the face mask wearing in the communities.
Okay.
And they will end up getting the infection rate high, and they will come to the hospital. So that is my biggest worry now.
Okay.
Normally, when you journalists you call, you say, what can we, the health people, do, or what are the doctors doing? We don't have problem. We are doing what we can. But the disease is not in the hospital. It is in the community. And if the community is not doing what they are supposed to do, we cannot do anything.
Okay. So
okay. Do you have any more questions?
Yeah. So the people living in the community and the frontline workers, how do they retaliate? I don't know if they face challenges when they go to the communities to take the samples.
That's why we are, because of community problem, the stigmatization and other things, we cannot tell where the patients are. We cannot tell even the assemblymen that maybe you have one person in your community and say that this is where the community, or if that way you want to, we can speak.
No problem. We can go the English line. Yeah.
Okay. So what I'm saying is that because of the stigma issue, we cannot tell you where the patients are. But we are doing what we are supposed to do. We know the patient, their contact. We have their telephone numbers. We talk to them every time. We tell them what they should do. But me and you, as community people, that we don't know these people, or we don't know whether I have it or you have it, we should observe the social distancing and put on face masks. And that is what is going to help us.
Doctor, can you predict the time Ghana will be free from this corona?
No, nobody can say. Because even in China now, Wuhan, where the thing started, now the second wave has started already. So even they are not able to stop it yet. So this one is going to continue for a long time. But I cannot tell you that 1 month or 2 months before it will stop.
Okay. Do you have anything to suggest to the community or any challenge to
Yes. What I want to suggest first to the journalists, they should focus their attention. They should focus their attention on what the community members are supposed to do. You see, why are they not putting on the face masks? Why are they not observing the social distancing? Those are the areas that you should focus. Because I can say the hospital is not that when you come to the hospital that you get the disease. Or a doctor can by force tell somebody to put on face mask. No. We are doing what we are supposed to do. Like we are saying, the people who tested positive, we are taking care of them. We know what they are supposed to do. We are doing. But the rest is up to we, the community members, the opinion leaders, and the law enforcement agency, and you, the journalists, to ask and continue to find out why people don't want to just follow simple instruction. That has been my biggest worry in this time.
Their challenge is that when they put on the mask, they find it difficult to breathe.
Okay, what about with the health workers? That we wear it every day. You see, beginning of everything is hard, but this is a life and death issue. We wear it every day. When we are operating in the theater, we wear it. 6 hours we stand and we wear it. And people should wear it. They down and they cannot wear it. You see, so this is what we are saying. If people cannot do, then to get to a time that if people are being sick and they come to the hospital, we can also take care of them. Because what they are supposed to do, they are not doing. And when the problem comes, they want to push to the hospital. So people should know that we are not in the normal time. In the whole, if you bought TV, now you see outside, everybody that works outside is in a face mask. Are they not human beings?
Yeah.
So why only Africa? And why Ghana? And why Ada? We are human beings. We have the same blood group as any other person. So we should try and keep on putting on, and we'll be used to it.